Good morning, my name is QIANHUI Zhang. Today my presentation will include the clinical manifestations of heart failure, and I will also use Mrs. Brown's case to emphasize the pathogenesis of the clinical manifestations. There are three parts of this presentation: introduction, body, and conclusion. For the introduction, at the beginning, I'm going to talk about an overview of heart failure. So what is heart failure? Heart failure is a complex clinical syndrome which develops as a result of any structural or functional heart disorder, impairing injection or filling of blood to systematic circulation so as to meet the systemic needs. Secondly, what causes heart failure? Heart failure is mainly caused by other preceding heart conditions like coronary artery disease, heart attack, and hypertension. Hypertension is a known cause as well as a symptom of heart failure. Thirdly, heart failure affects about 2 to 3% of the population in the United States. In this case study, Mrs. Brown, a 78-year-old patient who was diagnosed with acute exacerbation heart failure due to the various clinical manifestations. Some of the clinical manifestations include severe dyspnea, oxygen saturation 85% on room air, blood pressure 170 to 95, pulse rate of 120 beats per minute, and respiratory rate of 24 breaths per minute. So that's the introduction part of this oral presentation. Then we move on to the body part. What is the pathophysiology of heart failure? The pathophysiology of heart failure involves the inefficiency of heart muscles due to some damages or overload. Individuals who are affected by heart failure experience a failure in their heart contraction mechanism due to overloading, thus reducing the contraction forces. Relating to the case study, Mrs. Brown was diagnosed with acute exacerbation heart failure, which is an advanced version of heart failure. So firstly, I will talk some signs and symptoms of heart failure, which is related to Mrs. Brown. The common symptoms of heart failure are dyspnea and fatigue. And Mrs. Brown presents with severe dyspnea in this case study. Breathlessness, edema, tachycardia, and abdominal lump sounds are also the symptoms of heart failure. Mrs. Brown manifests with an elevated heart rate, which is 120 beats per minute, with atrial fibrillation, and also she presents with bilateral basal crackles on auscultation. Secondly, for the pathophysiology of heart failure, which related to clinical manifestations of Mrs. Brown, I will explain them below. Chronic heart failure is associated with atrial hypertension. Similarly, Mrs. Brown reports with a hypertensive state, blood pressure 170 to 95. It is also characterized by decreased carotid baroreceptor stimulation. Heart failure is also associated with reduced ventricular ejection fraction due to left ventricular dysfunction. Functional and structural defects in myocardium results in impairment of the ejection fraction or ventricular feeding. Dysfunction of the myocardium may also be associated with heart failure. Patients with heart failure may also present with signs of worsening effort-induced angina or dyspnea. Heart failure is also characterized ventricular-related dysfunction. Reduced cardiac function leads to reduced cardiac efficiency in delivery of oxygen to body organs and tissues. It is associated with respiratory composition. In Mrs. Brown's case, evidence of respiratory composition is shown by elevated respiratory rates, which is 24 breaths per minute, and reduced oxygen saturation, which is 85% on room air. The best method of diagnosing acute exacerbation heart failure is through the use of elevated jugular venous pressure, and the condition of the patient can be stabilized through giving her appropriate short therapies. And for conclusion, to summarize the main points, the pathophysiologies of acute exacerbation heart failure is what influences the occurrences of clinical manifestations such as severe dyspnea, oxygen saturation, blood pressure, pulse rate, and respiratory rates, which were exhibited by Mrs. Brown. The clinical manifestations of a disease and its pathophysiologies are highly rated because the pathophysiologies of a disease is what influences the clinical manifestations experienced by the patient. That's all for my oral presentation. Thanks for listening.